The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Sierra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I have Lacey Fisher back with me. She is a reproductive mental health therapist, and she is absolutely amazing. She's with Open Heart Counseling here in Austin. She's been on the show before, but today she is back to talk about something a little bit more near and dear to the birth worker heart. We're going to talk about a little bit about trauma when you are a birth worker, whether you're bringing your own birth trauma from your past birth into it, or you receive trauma from a birth that you attend. So thank you so much for tackling this podcast episode with me today.
Of course. Thanks for having me back.
This is actually your idea.
Yeah.
So you reached out to me and you were like, hey, could we talk about some vicarious trauma situations and even your own trauma kind of showing up in birth work? And I was like, yeah, because I am a birth doula trainer. And when I train birth doulas, it's funny, people come to birth work for different reasons, but a lot of times it is their own birth experience that brings them to birth work. And it's either that they had a really awful experience and they want to help other people's experience be better, or they had a rock star experience and like have to help other people do that. That one was me. And I didn't think I had any trauma. And then there are certain things that I can't handle in a birth that make me go, whoom. And I didn't know that I was bringing with me. And so even though my experience was positive, I still have things I brought with me. So why is this conversation so important?
It is because we just sometimes never know what may be triggered or brought back up for us. So when
trigger warning.
Yeah.
Right now, trigger warning. We're probably going to talk about some stuff that might be triggering.
Yes, the things that activate us. Even when I'm working with parents that are shocked, just taken back by like all these things, this trauma that I've had before, this childhood stuff coming up. I thought I was past that. And that happens too when we're so close to it, working in the birth world, whether you're like me and, a therapist working with someone going through it, or you're there in the delivery room or, the setting with them.
Or postpartum doula even.
Yeah.
And you know
absolutely.
what? I've actually recently realized it comes up in even sleep consulting and parent coaching.
Oh, I bet.
Because you might be coaching somebody through something and have your own trauma from what happened to you in childhood or what happened when you were helping your child through something. We all come in with our own biases.
Yeah, those things stick with you. And sometimes in our reproductive history, it's like there's not this timeline that it sees the months or the years in between. It's like everything related to it just comes rushing right back up, or it can. And that can just be jarring for some. And I remember I was leading some or facilitating some support groups for doulas that were getting their certification. And they said, they needed to come talk to someone about all the different things that can come up. And it's not bad. It's not that you're not doing something right if these things come up for you. We're humans. We have trauma histories and they stay with us. So the more we know and talk about it and just kind of, normalize that it's there, we can get ahead of the symptoms or, what can lead to vicarious trauma. So we're all subject to it.
And, I've heard, and, the body remembers, you hear that. And, I was a C-section baby, right? And my mom had like emergent preeclampsia in labor, 19 hours of labor at 19 years old. And all of a sudden we had to be rushed to C-section because her blood pressure's through the roof, all of these, and it's life-saving, right? Yeah. But they say that the body remembers. Like, I wonder if that has anything to do with why I was so passionate. I don't know. Right. And then also, I hemorrhaged with my son after I gave birth, and I had a really awesome birth experience. But then now when I'm at births, if that's my trigger is blood, is if I hear it if I hear it falling or if I see it pooling. I was at a birth last week and it was a beautiful home birth. And I said to the midwife at one point, I'm so glad I'm not you. And she goes, why? I said, because that pool has turned straight up red. And I would be getting her out of the tub because I'd be like, just in case.
Yeah.
And she even said to the midwife, can I just have 5 more minutes? And I was like, in my head, I'm like, do we have 5 more minutes? Like, and she goes, I can still see her legs. Like, I can still see the color of her legs. And I'm like, but what if we can't in 2 minutes?
Right.
Because that's my thing. I can't handle it.
Your system is still like, hey, it turns that quickly.
Danger.
We have to be on guard for it.
Yeah. Danger. So, what are some early signs? Those are some real signs. And I think for newer doulas too, or newer birth workers, they might go, I don't think that that's going to happen to me. Or how could that happen to me? What are some examples? So that's why I wanted to give those examples of the places that it comes up for me. But what are some early signs that maybe a doula or a provider, because, nurses, OBs, midwives, that they may have their own past experiences being triggered?
I say one, if that's a clear thing, you're like, wow, I remember this story. Either it happened to me or my sister or someone else, and it's bringing all that back up. I mean, that's a clear sign, but sometimes they're a little more subtle. It can be like, I'm very excited. I've loved this work. And then all of a sudden, I'm not jazzed about it anymore, or I'm feeling really fearful, or I'm just annoyed by people asking me to do things. Or, starting to look through every situation like, oh no, this may come up and I really don't think I want to do that, or this may, and I don't think that's for me. We should be boundaried and we have a, choice on what we take on. But I think if it's happening where nothing just sounds good to you, and you're finding yourself like in your home life, not even liking the things that you normally used to, not finding inspiration in the things that you used to, or motivation. Those are some of the first signs that you may be moving towards either burnout, or that burnout being a result of vicarious trauma. And then, sorry.
No, please, you go.
Just thinking then the other things too, like when you are in a birth and maybe you're handling it, and you feel like you're doing okay, but you just can't seem to let it go, or it's like playing in your mind over and over, or you're like, oh, I should have did this, or I should have done that. And it's like maybe months have gone by and you're still kind of focusing
picking
on
it apart.
One thing. Yeah. And it's like, okay. And you do that across the board, then
yeah, I've even seen this come up in training. So I've seen doulas that I'm training that have a severe bias toward hospitals or against hospitals. And like some people like home birth only, or like, oh no, I'm not attending out of hospital births. That's dangerous. And they don't see that as actually a trauma response from something they've gone through. Like I've had moms who only had home births for themselves, and then they come and train as a doula, and they're like, I don't know that I can go into a hospital birth. But they don't see that that's the connection between, that's a trauma response of like, you've heard these negative stories about a hospital, so you're kind of preemptive strike, like, I'm not going to do that. And I'm like, hey, some people you might transfer from out of hospital birth to a hospital. So how are you going to handle that?
Yeah. And you may have to. And then also, again, realizing that for other people, what may be safe to them and they still want to doula is in those settings. And so, and that's, another sign too, is like, how much are you putting your own stuff into it? We all have to be aware of what we're bringing into it. Because again, we all have a reproductive history, whether we've had children or not. So all these things can come up, and that would be an indicator as well, as like, am I putting too much of like my value on it? When another person is, saying, this is what I need though. That's what I need. Then again, we can still choose like, hey, these are the families I'm going to work with or not, but it's something to look into.
Yeah. Birth doulas specifically, doulas in general. So I know that nurses too, and sometimes OBs, but maybe a little bit less so. And maybe that's my own biases popping up, but we tend to be pretty empathetic beings. And so is there a way that someone can tell between being deeply empathetic and then becoming emotionally overwhelmed? Because I think that there actually is a really fine line, and you don't want to lose the empathy, but you don't maybe it's the same things you already said, like being distracted outside of that time and not
Well, I
being able to
think those
drop it.
things in addition, but where maybe you're kind of crossing to where you're getting too emotionally, empathic to where it's causing you to not be able to let it go. Like maybe you're going at home and you're just not it's not just letting it go right away after it happens, but you find yourself maybe dreaming about it or certain clients, or just the sense of like, I'm not doing anything right. I'm not doing enough. Or you let boundaries slip, say that you do have that, like, I don't do this type of thing, for people because that's what I need for my mental health. But then you start to blur those lines for others. And it is rooted. We're healers. We want to help people.
Yeah.
And then we can step too far. And so I think that if it's causing that, you just like can't compartmentalize it anymore. Of course, there are going to be some births and some stories that stick with us more than others. And the work that I do, I work a lot with pregnancy loss and stillbirth and infant loss. Those things stick with me. But it's like a difference of, can I still contain it and put it in a box to take care of my family, or no, all of that over here, the family stuff is falling because I can't stop thinking about those other things.
I've had a lot of doulas are like, okay, but now that I'm a doula, I can't have more kids because I know too much. And I even did an episode with somebody who was a doula and she wasn't for her first baby. And then she was for her second baby. And she's like, oh, it's different. I knew too much. And then, somebody else that I know had a baby after becoming a doula. And she was like, I'm having to talk myself out of things every day because again, I know too much. And I think it's similar with this, it's like if you can't compartmentalize it, and maybe some people look at that as a negative thing, but it can really be a positive thing and a way to protect ourselves.
Of course. Yeah.
I've heard, of course, there are things you can do later to help heal yourself, but in the moment, in a traumatic situation, is there anything anyone can do to kind of help themselves get through it in that moment?
Yes, I say in that moment,
effective, I guess.
We're going to be doing some things to kind of set up before because we don't know when it's going to happen. And even though we've done a lot of trauma work in the past, things can come up. We don't know what is going to activate us at a different time. So to kind of safeguard against that, maybe you start planning, your rituals. What are your self-care rituals or your grounding rituals that each time you go in, that if you need, you have like, either it's a necklace or something in your pocket that's like maybe a stone that has a word written on it, a mantra, that when you start to feel yourself like leaving your body or your heart racing, you're like, oh no, I'm not focused where I need to be. I'm getting too activated. You grab onto that object and it's your anchor. It's your reminder. I'm here. I'm safe. This is not that time. This is a different time. And I can still function. Are there, even if you're not able to carry stuff with you? Because I know sometimes like we don't need certain things in, certain medical settings, but
maybe a bracelet or something.
Yeah, something. And that can
I actually know somebody who snaps a band on her wrist.
Yeah. Things like
that. And that sounds like painful and like bad, but it's just like a snap out of it to her. Yes. That's what she connects it with. Snap out of it.
Yep. Anything to get you back in your body. And it can be too, is like, okay, I'm standing here. I know where I am. I know what hospital or birthing center I'm at. I know what day it is. Just anything to make you feel more in the present and neutral. We don't always have to go for positive rainbow, happy thinking. Sometimes we just need to be neutral. Our nervous system just needs to be reset in that moment. Just a quick little shift to say, I'm here. And I'm okay.
It's so cool that you just said that because I was at a birth last week with a mom who has severe past trauma from childhood. And it was her second birth. And she actually tagged me on Instagram, I think it was, about this story. And she had major trauma come up during this birth. And she said it out loud. And I knew that her partner had training in somehow into how to bring her back, because he said the city that they were in, he said, this isn't about that. This is about you. And we are in, and he said where we were, and we're in our house, and you're in our bathroom, and you're in this tub. And he went from wide to narrow. And I was like, that was it just gave me chills just saying it. It was one of the most beautiful things. And at their postpartum visit, I wanted to make sure that they remembered that he said that, because that was such a beautiful thing that he did for her in that moment. And we can do that for ourselves. We don't have to have external humans to help us through those things if we just kind of practice what we would do just like when we prepare for birth, we tell people you have to get into those different positions with your belly as it grows and all of these things. Well, we have to also practice those things as we go, because we're going to end up burnout and jaded, and then we're of no help to anybody. And I say that too. I'm like, we'll be just as bad as some of the providers that we can't stand if we start to judge every situation based on the last one. We have to leave the last one at the door.
Right. Yeah. And then it's always a time to say, what do I want to do differently next time? And having these things in advance is helpful. If we're in a moment of stress and we're trying to plan something to help, then we're not going to be able to, because we don't have access to the front part of our brain that can do that. So if you already have something set up, you're more likely to be able to pull and remember that. And just like I do a lot of, mental health birth safety planning for people with trauma before they go in. And we talk with partners about things they can do. And it's the same thing for us as the providers or the people around. What can we do for our own safety, mental health safety planning in these times? And then I would say, even if you're experiencing a really tough situation and you're getting activated on the way home, can you even change clothes before you leave the setting so you get that off of you? And that's like a transition. Can you take a moment in your car to put on a favorite playlist, maybe even take a different direction home, or say, you know what, today I'm going to stop and get whatever treat, whatever nourishment that it is you need before you go home, so you can help just kind of shed what that was. Like, give yourself a true transition. Those are things that can help when leaving those settings.
I've heard, and I don't know the research. I didn't look it up before this, and I surely didn't prep you that I was going to ask you about this. But I've heard this thing about, I think it was Tetris that they used, where if you do a puzzle or Tetris or something like that very quickly after a traumatic incident or a stressful incident, that it impacts you less. Have you heard this?
No, but very interesting.
It was something about even in birth, for people, even if they got an epidural or something, playing Tetris, when they gave people Tetris and didn't, the people that had felt less trauma from an experience. Yeah. I've got to look this up now. I should have prepared for this. But I play Candy Crush a lot, and people make fun of me. My husband makes fun of me. I'm like, well, I'm not traumatized. And it's like I need it to reset my brain and to disconnect from the things that I was doing. I use it in a lot of situations. It's kind of like my downtime during the day. Even if I'm eating lunch, I just need to clear my brain, and I play Candy Crush.
I think so. I see how it works, because this is what, some people would say, how to hack your nervous system. You're giving it just that little shift, right? From the really activating, scary future, spiral of worry of what could happen, or freezing, shutting down, to this is what's neutral in my environment right now, or I'm distracted. I'm focused on something that is neutral. It's not threatening, and it resets your nervous system. So because it's like mindfulness, other things you can do. Yeah. Other things you can do in that moment is just I'm going to look around the room and I'm going to count how many things I see that are red.
Yes.
And then I'm going to count how many things are blue. Anything just to get you back. And I kind of keep doing this, coming back to the center, right? Just coming back to the center, centering your nervous system again. Then you can reset and begin again. And if you have to do that 50 times, then do it,
Yeah. Absolutely. I'm gonna try to remember to put this in the show notes. I looked it up. Psychology Today. How Tetris might help prevent PTSD.
Love it.
A video game may affect how traumatic experiences get imprinted on the brain. I feel like Candy Crush should be on the list. I'm gonna look up and see if there are similarities to Tetris and Candy Crush.
I can see the problem solving in it, feeling like I'm controlling something and I'm making it work and I'm making the lines disappear. Oh, it's all working,
It says when you focus on fitting shapes into rows, you interrupt the intrusive memory formation associated with PTSD. Isn't that cool?
Awesome.
Yeah, I love that. So then we also need, the self-care aspect. And I think that self-care is so much easier said than done, because especially in a birth worker's on-call or weird schedule. So even postpartum doulas, even when you're not on call, you still a lot of night shift work and things like that. what would count as self-care, and what are some realistic ways to implement that into a routine?
Right. When you're not able to be like, oh, I can go have a massage right now while I'm on call. No, we don't all
joke,
get that.
because
No
hey,
privilege.
within 24 hours, if you cancel, they charge you anyway, which I understand, but I can't guarantee I'm going to get there.
Yeah. I'm going to go back to saying, I think the mindfulness piece of it, where if you can make this a practice, not just in the moment when it's stressful, doing this several times throughout the day. If you're thinking about how can I reset my nervous system so that it's almost like we have this volcano of things that pile up throughout each day. And each time we can center ourselves again, we kind of move some of that down. So then we are on call and we don't have time to go get a massage or whatever, the hot bath. We're less likely to explode or be way activated.
Overflow.
So I think doing that throughout, and that can even just, be, I think gratitude can come way into that and incorporate that with your mindfulness of like, what are the things that are going really well with my day today? Checking in with that. And then if you are on call and you're waiting and this could be another moment thing too, when things are really stressful, have a way that you can say, I'm going to write 1 to 3 things that really went well today or that I'm thankful for, just to keep yourself too in the more grounded mindset of there is another side of this. Like this time will be over. This, trauma that I'm witnessing right now, we will get through this. There is another side of this. And I will be walking out of this hospital at some point. We don't know the exact outcome, right? Or how we feel, but at some point we know we will be walking out of this setting, and you can regroup then. So
yeah, I think that a lot of people, we preach positivity and like affirmations, and we attract what we focus on, and the law of motivation and all of this. I teach that in hypnobirthing classes, and I apply it to birth for the person giving birth a lot. But it's so easy to get caught up in negativity because there's a lot of freaking frustrating things as a birth worker.
Right. We don't want to minimize
something. Yeah. And we know something, and like, we don't want to add trauma to the person giving birth by telling them this is a bunch of crap, but also we have it boiling up inside of us. And so it's so easy to get focused on the negative and get frustrated and start like being down about it. And then talking to 5 people and complaining to those 5 people about the whole thing. Like we have to talk about the positive too. And so it's such a good reminder, like not to just like doom scroll in our brain all day about all the stuff that's making us mad.
Yeah, I tell everyone, because we don't want to minimize the experiences and the things that were wrongfully done. So we change that language to this happened and
not but.
I'm walking out of this, and it was a hard, horrible experience. And this was the thing that happened that was really well, that went well. It's just balancing. How do we balance? And I was thinking this is another mindfulness kind of or thing that I like to teach a lot of my clients when you were talking about doom scrolling, since we all do it and we all have our phones. Sometimes I say when we have a lot of worries or activation and it comes up in the form of thoughts, if we just imagine we're holding our little phone that has all of our worries, all the things we're upset about, and we're looking at it like it's real, and we notice it. We don't analyze it. We don't stick with it too long. We're like, oh, I see it. That's my thought. And then we scroll up, like you're imagining scrolling up. Do it to the next thought until you can just kind of get to the screen to go blank in your little imaginary phone.
You've really updated to the modern day for that. That is
a movie theater.
Yeah, Lacey really pulled it into 2026 right now. That's hilarious. I love that.
It's like your own TikTok in your head. How can we just move it along?
Yeah. And words are important. And I love that you said and instead of but. And this is so funny. I used to watch a lot of Dr. Phil back in the day. I loved Dr. Phil. And he would say, if somebody said blah, 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 but, and then said something, I was like, no, because but means forget everything I just said. Here's what I really mean. And so I think that all the time. I'm like, do not but me. Right. So yes. And adding to instead of like negating everything else, I think is really great. So if there was one thing that you wish every doula or birth worker knew about taking care of themselves, what advice would you give, or what nugget of information?
Yeah. I think the first thing would be you have permission to take care of yourself and prioritize yourself and your values and hold your boundaries. And the other thing is none of us are immune to it. It doesn't mean anything about you. if you get burnout, vicarious trauma, or that things stick with you a little longer, just use that as data to say, hey, there's something underneath that's sticking with me a little more. And do I need to go talk to someone about that, whether that's a peer or, in a group setting, or mental health therapists are there for helping people through vicarious trauma. A lot of places that you can go to process, like, why is this sticking with me so much? Just be curious about it.
Yeah, we don't have to sacrifice ourselves. I think, especially in this work, it's such heart work, but it also is a business. And so there's so many angles to it. It kind of is tough when you have to do the business end of things and the heart work side of things, because then you feel like you have to blur the boundaries sometimes or go past what you were willing to do because, well, it's their birthing day or like it's their postpartum. This is so important to them. And I used to feel in the early days like I just had to be everything to everyone. Yeah. And I stopped doing that because I was like, I will lose myself and I won't be able to do this work anymore. And so now I try to make myself less important. Like, yes, I can be an important part of your story, but it doesn't all hang on whether or not it's me. Like, they're asking me questions like, well, how many births do you take? And, how often do you need a backup or whatever? And I'm like, you know what? I don't take too many births because I don't want to have backups, but that's not the only reason that I may need a backup. And so I tell people I may need a backup because I'm sick, or I may need a backup because I was at another birth and I'm not recovered enough yet to be able to show up well for you.
To be the best for you.
Humanizing yourself to your clients, I think, is so important because it's not only a traumatic birth experience or your own past birth experience that can impact your mental health. It's feeling like everyone's relying on you and that you don't have enough of you to go around. And I think that in and of itself can cause burnout and trauma.
Yeah. And that's one of our biggest forms of self-care. And I tell this to clinicians, new clinicians that I'm supervising and training, teaching, is we're human first. Sometimes people look at us as like, we're that thing first. We're doulas first. We're doctors first. We're therapists first. We're human as well. We're human first. So you can take care of you. And yeah, when you're trying to be everything to everyone, you end up being like, you can't do that for anyone. So
yeah. One of the things I also, when solo doula is like, if you don't automatically have a backup or like you're not in a co-doula relationship, I remind them like, it's okay to tell them that my anniversary is that month and I have a backup doula that day. Or like I have a couple of family events because and this, I wouldn't be able to do this work if I didn't show up to my own kid's birthday party, you know? And then they're like, oh, she has her own kids. Like, yeah, we don't want her to miss her kid's birthday party, but you have to make yourself human because they think we're Superman. And I love, sure, that's fun. That's fun to have people think that you're the be all end all and you made magic on their birthing day. But also, you don't want to make it so that you feel like you're the only person that can help them that day.
Right. Absolutely.
Awesome. This conversation is so important. Did we miss anything? Did we not touch on anything you were hoping to touch on?
I think that was it. Just talk. Please don't be afraid. I think a lot of people will hold that in because they fear judgment of their peers. Like, oh, I think I'm not strong enough to do this work. That is a part of what we all go through across the whole spectrum of any type of birth worker. We're human, and these things, they mean a lot because we care a lot. So don't be afraid to talk it through.
I love that. Would you share with people, and I'll of course add it to the show notes, how they can find you if they want to learn more from you or work with you?
Yes, absolutely. You can look up www.openheartcounselingatx.com, or if you just Google Open Heart Counseling of Austin or Lacey Fisher, you'll see me. We do a lot of reproductive work and work with a lot of clinicians or birth workers across the whole spectrum.
Yeah, absolutely. Thank you so much for being here for this important conversation.
Absolutely. Thank you.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.